Hello everyone, welcome to Vasomeritech Heal Your Heart EECP Treatment Center. Today we are going to discuss about second opinion. Most of the patient who comes for a second opinion, they believe they are a ticking time bomb. Now this ticking time bomb is a concept which is introduced in early 80s and late 90s. So what it means is, once the cardiologist identified that you have a block in your coronary vessels or blood flowing to your heart muscle is getting obstructed, then they assume this patient is going to get a heart attack anytime, and hence these patients are called as a ticking time bomb. Now many of the patient who walks in our clinic for a second opinion also believe the same, because they've been informed they have a block, and they also been informed they're in a high risk that anytime they get a heart attack. But these patients are normal, they are able to do the routine activities, and their quality of life is okay, but still there is a scare they might going to get a heart attack sooner. So what should we do? The option for them is to undergo a stent. Now the question is whether the stent is optimal and it is good for them or it is not. And before we go against a stent, let us be very clear: angioplasty or stent, one of a life-saving procedure in cardiology. If you are having an ongoing heart attack, it means there is a lack of blood flow to the heart muscle and your heart muscle is struggling and you're slowly having a heart attack. In this case, the only way to get the patient out of pain, to get out of muscle damage and to prevent death is to put a stent. So while the patient is ongoing on a heart attack, when you place a stent, it relieves the chest pain, it restores the blood flow, it saves the heart muscle and also save the patient's life. So there is no question about that. Here the question is, these patients when they come with a ticking time bomb, they are normal, they didn't have a heart attack, they are not going on an ongoing heart attack, but still they are afraid. Now the question is very reasonable and very logical. Your doctor may simply explain to you, look, we don't want to wait until you get a heart attack in emergency and we want to put you a stent. Let us put a stent now and save you from getting a heart attack in the future. Now this looks perfectly fine, and this is how lakhs and lakhs of patients are convinced and undergo this procedure called angioplasty across the globe. So possibly there are at least 1 to 2 lakhs angioplasty are done every year across the globe. Now what is wrong in that? I mean, it looks reasonable, it looks logic, but the real answer is, so if it is not clinically proven, you cannot do that. So what is the evidence for this? Actually, this assumption of what we call as a preventive stenting. It means you have a block, you don't have a heart attack, but you have some symptoms, you have some abnormalities in the ECG and echo, and now you believe that you may undergo a stent so that to prevent a heart attack. This concept was questioned by a trial, and this is called Courage trial. This is not a simple trial. It involved multiple countries with leading institution, top cardiologist institute in the world, and they all gathered to do this trial to check this hypothesis that preventive stent is good for the patient. Now what they did is, they took almost 2,200 plus patients. Now all these patients have some problem with their ECG and maybe some problem with their echocardiography, and their doctors have already done an angiogram and they have identified there is a block, and this block is more than 80%. This scenario, I don't think any cardiologist will let you out. They would insist that you do for a angioplasty immediately and right away. Now these type of patients were recruited and they are split into two groups, group A and group B. So all these patients will go through medical management, lifestyle changes, hypertension management, diabetic management, and all the risk factor control. But this one group, group A, along with this, they also undergo a angioplasty. But the second group, they were just managed with the medicines and lifestyle changes and risk management, and they did not go for a angioplasty at all. So these two group of patients were followed for 5 years to see the result. Now this result actually astonishing, because it changed what the cardiologist actually is. Now what the result came out is surprising to the cardiology community across the globe. So in 5 years, both the group A and both the group B behaved in the same manner. It means the number of heart attack, stroke, hospitalization for cardiac problem, and even death remained same. In fact, in 5 years, heart attack or death happened in around 18 to 19% in both the group, which no change at all. Now this is a surprising finding. So putting a stent as a prevention would not have any benefit to the patient. So keeping them in the conservative management and regular exercise, it's much better than putting a stent, because when they put a stent, they carry a risk of certain medication has to be taken lifelong, but the medicine group doesn't have it. Now second is, what about the symptom? Because many times we argue that at least the stent will help you to relieve my symptom. system. In this trial, around 2 to 3 years or 3 to 4 years, most of the patient who got little bit benefit from the stent, that is a reduction in angina, was also similar in both the groups. So basically, we are trying to tell you stenting as a prevention to prevent when you are in a good health, good cardiac condition with minor symptom, it's better to go for a conservative management. If your conservative management is not optimal, add up another non-invasive treatment called enhanced external counterpulsation before even going to try to get a stenting, because it is not going to be beneficial at all. Now the answer is, why would you say that? Because stenting seems to be a good procedure, and why the stent has not prevent a heart attack as it is supposed to be. Now the answer to this is very crucial that every patient should understand. So if you are forming a block, this block did not form in a one night or a couple of weeks before. It's been gradually happening in your body for almost 3 to 4 years. So by the time it reaches around 70 to 80%, enough to obstruct the blood flow so that to causes chest pain, they are already become very stable and they usually will not break. So if the block doesn't break, it will not cause a heart attack. But most of the heart attacks are not caused by this block, which is 80 to 90%. The block which is formed recently, but they have not grown enough, but they are only 20 to 30% and they are not stable. It means they are not closed enough by a strong elastic tissue or fibrous cap. So what happens is they break easily and causes heart attack. So this is a reason the stenting, you get it for a stenosis which is more than 70%. It's not the culprit. The culprit is a small block which happens throughout your circulation or throughout your coronary vessel. So these are all usually taken care by regular exercise and also control over your food and medication. And if your symptom persists, it's better to add something like a non-invasive enhanced external counterpulsation as an option rather than going for the stenting. So the COURAGE trial is very clear. There is nothing called preventive stenting would help you. So if you are a patient with blockage with some changes in ECG and echocardiography, don't go right away for stenting. Wait, complete all this conservative management. It fails and then you can go for a stenting to relieve a pain for a couple of years more.